For a third day running, there have been scenes of chaos and bloodshed at food distribution sites being operated by the widely criticised Israeli and US-backed Gaza Humanitarian Foundation. Another 27 Palestinians have been killed today, with dozens more wounded by Israeli fire in the south of the besieged territory. The UN's Human Rights Office is describing the attacks on civilians this week as unconscionable, suggesting they may constitute a war crime. Separately, the controversial foundation has named an evangelical Christian leader as its new chairman. Well, for more, we're joined now by London-based emergency physician Dr. James Smith. He's also a lecturer in humanitarian policy and practice at UCL. Doctor, thanks so much for being with us this evening. I know you have yourself worked in Gaza between December 2023 and January 2024, again between April and June last year. So describe, if you can, the conditions in hospitals there when you were working in Gaza and how it compared to other places that you've worked in the past.
I mean, the conditions in the hospitals when I was there exactly this time last year were beyond horrific. The footage that you can see there is actually a hospital I worked in. Probably I spent most of my time actually at Al-Aqsa Hospital, which you can see there. I recognize some of the healthcare workers in that footage. We were treating patients on the floor, children, adults, children that were dying on the floor with no one around them, nothing that we could do other than to wrap them in blankets. We didn't have pain relief for patients that were for palliative intervention only. I mean, the most horrific conditions I've certainly worked in anywhere in the world in the time that I've been a doctor. And that was a year ago. The situation has deteriorated day on day since June of last year, or indeed since October of 2023. Much of the healthcare system in Gaza has effectively collapsed. Blood banks that are out of blood, healthcare workers having to donate blood to give to patients. The Ministry of Health in Gaza has announced that as of May of this year, at least 50% of essential medicines classified as essential by the World Health Organization no longer exist in their central stores. Effectively, healthcare workers are having to adapt with what little resources they have under the most horrific conditions.
And James, the IDF also issued fresh evacuation orders for Han Yunis late on Monday, prompting warnings that those orders could halt work at the Nasser Hospital, the largest still functioning medical facility in southern Gaza. What kind of consequences is that going to have on people living there, all of those people who so desperately need assistance?
So in the last couple of weeks, the Israeli military have issued these so-called evacuation. They're effectively forced displacement orders for the entirety of the east of Khan Yunis, which is the second largest city in Gaza, and the entirety of Rafah, the Rafah governorate in the south. As you say, in the last 24 hours or so, they've issued new forced evacuation orders for two of these grids that they have just invented that are immediately adjacent to Nasser Hospital. One of the grids that's now in the red zone, as they call it, is Al-Amal Hospital, which is run by the Palestine Red Crescent. A lack of access to these facilities will be catastrophic. I mean, Nasser Hospital is one of the few facilities that's still able to provide some form of specialist care in the south and middle areas of Gaza. If patients aren't able to access that hospital, or if staff and patients are forced to flee, which of course they may well have to, given that they know full well what has happened when the Israeli military have besieged other facilities, then you have a population of 2.1 million people who will be deprived even further of the most basic medical and surgical care that is required to save lives.
And James, as we've been reporting, another 27 people seeking aid killed today near an aid distribution centre. What is your view, as someone who's worked in Gaza, of this controversial new foundation that's been set up to provide aid to Palestinians?
I mean, these are horrific reports that are coming in. At least 3 consecutive days now, Israeli soldiers have opened fire on people seeking food at these so-called aid centers. There were attacks the week prior as well. We're talking about hundreds of people that have been killed and injured in what appear to be orchestrated attacks. So people that have been deprived of food, water, shelter, medicine for 93 consecutive days are, of course, desperate. They're going to these aid centers to try and find what little food is being provided to them, and they're being met by hails of gunfire and artillery fire. The Gaza Humanitarian Foundation is a US and Israeli-backed initiative. It's been widely condemned at the highest possible level within the pre-existing UN system. Almost unanimously, the pre-existing humanitarian architecture, from Doctors Without Borders through to the UN Humanitarian Agency, have condemned the approach taken by the Gaza Humanitarian Foundation and have declared that it is an expression of the instrumentalization and militarization of aid. And as you can see here from what's happened in the last couple of days, this is not a system or an institution that can be trusted in any way whatsoever. It is causing death and even greater violence for the Palestinian people.
And James, as you've pointed out, Israel has imposed a blockade on Gaza in some form or another for 17 years. So why has a blind eye essentially been turned to the situation there for so long?
I think this is one of the most important questions to be asking now. This is not a blockade of just 93 days. This is 93 days and 17 years and another 60 years of occupation, of dehumanization, of ethnic cleansing, and acute on chronic genocide, slow death, whereby millions of Palestinians, both inside occupied Palestine and living now in exile, have been deprived of their most basic rights. Israel has been permitted by the international community to operate with near total impunity, repeated flagrant breaches of international law that have permitted the extreme violence that we're now seeing. Genocide doesn't simply happen from one day to the next. The conditions required for genocidal intent and genocidal execution to fester have been brewing now for decades. And it is that culture of impunity, pervasive anti-Palestinian racism, progressive dehumanization of the Palestinian people that has allowed what we're now seeing to play out.
And James, international journalists, as we know, they've been blocked from reporting from Gaza. So do you feel, as a doctor who has worked there, a moral responsibility to bear witness, as it were, to what you saw while you were there?
Absolutely. All healthcare workers, all humanitarian workers are morally obligated to speak out about what they've seen. There is, of course, a risk that in so doing, you might not be permitted to go back to Gaza, but there will be other healthcare workers who are committed, who will follow you. You go, you do your caregiving, you act and stand in solidarity with the Palestinian people, and then you leave Gaza and you testify as to the atrocities that you've witnessed. As you've mentioned, international journalists aren't permitted into Gaza. Palestinian journalists, because of this dehumanization and anti-Palestinian racism that I've mentioned, their witnessing, their reporting has been undermined repeatedly. It's really imperative that those of us, those few people that are privileged enough to have this limited privileged access, speak out about what we've witnessed. And that's what I and many others have been doing now for almost 20 months.
And was it a difficult decision for you initially to go to Gaza and then to return again last year?
I think the most difficult decision for me was to have left Gaza. I think every day about my Palestinian colleagues there, many of whom are enduring conditions that most of us simply cannot comprehend and will never, thankfully, will never have to endure. Friends and colleagues that have endured 20 months of this, and of course, decades of occupation prior to. It was very clear to me that as a healthcare worker, as somebody who cares about care, who cares about giving care, who cares about acting and moving in solidarity, that I should be there in Palestine. And I think we should all be moved to act in whatever ways we possibly can to bring an end to this genocidal barbarity wherever we are in the world.
James, we'll have to leave it there for now. We do really appreciate you taking the time out to speak to us on the programme this evening. That's Dr. James Smith, a London-based emergency physician, also a lecturer in humanitarian policy at UCL.